Immunodeficiency virus, known as HIV, is an infection that attacks the body's immune system, specifically the white blood cells, that has claimed 40.4 million lives. It's a virus that damages the cells of the immune system, weakening its ability to fight everyday infections. In tackling this health concern in Nigeria, the Director General of the National Agency for the Control of AIDS, Dr. Temitope Ilori, has urged Nigerians to come together to stem the tide of HIV and AIDS nationally, and also to ensure that the year 2030 target of making HIV and AIDS a less epidemic disease becomes a reality. So let's talk this through. As we have joining us in the studio is the first female Director General, National Agency for the Control of AIDS, NACA, Dr. Temitope Ilori. Thank you so much for joining us in the studio this morning.
Good morning. Good morning, Nigerians. Good morning, everyone.
Absolutely. So when Nigerians or anyone hears HIV or even AIDS, HIV and AIDS, but HIV first, they begin to wonder, why do we still talk about HIV and AIDS at this day and age, and then we are looking at 2030 to eradicate it. Exactly where are we in this, journey?
Yeah, thank you so much. Good morning. I like the introduction that you gave, and just to say that HIV/AIDS is still very much with us. Though we've done so much, in terms of curbing the menace, there's a global target that says 95, 95, 95, that at least 95% of the population should be tested, and 95% of that population should be on treatment, and, so that, 95% of them would at least have viral suppression, that is, the virus is so low in their blood they cannot transmit the infection. But fortunately, even though we seem to be doing well, particularly amongst the general population, we're not doing so well amongst our women. About 60% of, as we speak today, about 2 million Nigerians are HIV positive. About 1.6 million of them are on treatment for HIV infection, and about 60% of this population are women. But data shows us, science, studies showed us globally that Nigeria, as of today, is accounting for about a quarter of women with HIV/AIDS, particularly pregnant women. And that as we speak today, Nigeria has the highest burden of children born with HIV/AIDS. And that is why we say we're not doing so well. So just about a third of our women, about 35% of our women, are actually assessing treatment while they're pregnant. And
So before I take you up on the mother to transmission, percentage, that percentage you gave us about 2 million Nigerians living with HIV is sort of debatable, especially looking at the level of stigmatization we still experience with AIDS, and so many people are yet to even go for testing at this point. So I'm sure that 2 million figure you have are those that have been tested and probably undergoing treatment. But looking at the 2030 targets by the World Health Organization, how realistic is this, looking at Nigeria's HIV response and the rate of stigmatization?
It's very realistic, and that is why we are here today, because we need the media awareness, we need to create the awareness, because we realize that HIV/AIDS is not just a health problem, it's actually a multi-sectorial problem. And that is why we all have to come on board, the media, both the TV, the radio station, even the the social media. We need to engage our people, particularly the youth, because we do know that the young people, they are more at risk because of their risky sexual behaviors. So we need to engage them. And particularly even in our community, we need to do a lot of community awareness, engaging the traditional leaders, the community leaders, even our religious leaders, on the pulpits and the mosque and the church, because we know that these people, they're hacking onto their voices. So we need to encourage them and to incorporate them even in this awareness. So now we are kind of, coming out again to say it is real, it is here with us, and we need to find the people, test them, put them on treatment, so that at least we can all be safe at the end of the day.
So I want to take you up on the mother-to-child transmission. What is really leading to the increase in this? Have we not grown technologically to be able to track this data and leverage on it to address this problem?
Thank you. Yes, we have the data, and we are improving on the data. In fact, in our agency, we have this scheme we're doing, we say getting the data right. So, in fact, we're retesting even those that are already on treatment and be sure that, we have the data right. And we have the drugs. The drugs are actually free. In all government hospitals, you can actually get drugs for HIV treatment free of charge. We have the test kits. Government is providing that free of charge in all government facilities, be it at the local government, at the state government, at the teaching hospitals. And we even have what we refer to as the self-testing kit. Though that is not, for now, you have to buy it. It costs not so much, but you get it in big pharmacy, where you can actually sit in your bedroom or sit in your bathroom and do your own testing. So we have all this available. But like I said, we realize that some people are not assessing this. For instance, let me take, for instance, pregnant women. Some people do not deliver in hospitals. They rather deliver in mission homes or with the traditional birth attendants or even in their homes. So part of our campaign, part of our strategy, like I said, is to go to these traditional birth attendants, educate them, give them test kits, that when these women come, they should test them for HIV, and if found to be positive, they should refer them to health centers. Ditto for the community. We are doing some community testing door to door and some outreaches to make sure that we test. We go to schools, and then we encourage even religious leaders to encourage their members to test, And I'm happy many churches are doing that before marriage and all that. But that is not to say they have to disclose to their religious leaders. But, as a couple, you should know your status and you should be able to disclose amongst yourselves.
Yeah, I'll tell you a very brief experience of mine. About 5 years ago in Ibadan, I went for a testing for HIV, and then immediately after the testing, I was given a pack of condom, and I crossed to the other side. I was not thinking, why did they have to give me a pack of condom? Does that mean, or did that mean I was positive? Then I crossed back, tried to check what the lady wrote down, and I saw negative. So I was not wondering exactly why, because people are asking, they are querying this experience, like, why do you have to share condoms to people? Why not share pads, the sanitary pads, for ladies? Why don't you make it free? Why do you have to make, shield free?
Well, number one, let me find that. I hope when you went for your testing, you were cancelled, because we have what we refer to as pre-test counseling, post-test counseling.
I was negative all the way.
Even if you're negative, the system, says you should give a pre-test counseling so that you know what to expect, and then a post-test counseling, and then they give you your result. So that is actually the protocol. And if that is followed, even though you're negative, yes, you could be given condoms, because it's part of the preventive measures. We talk about abstinence, which is the A. We talk about being faithful to your partner or to one partner, if you can. And we talk about condom, which is the C. So it is not as if we're encouraging people, but we do know that sex is everywhere, and we want people to have safe sex.
Responsible, yeah.
That's right. So I also want to talk to you about your assessment of the level of stigmatization and discrimination we face as regards that so many persons are still hidden, unknown, unidentified as regards this HIV infection. What is the agency doing as regards this? Because you talked about educating the nurses, educating the medical practitioners, but also public enlightenment, I believe, is key at this time to help people speak out.
Yeah. Thank you very much. Like I keep saying, we're partners, and that is why we're here today. But yes, interestingly, there are anti-stigmatization law, that has been passed even into law nationally, and many of the states have actually domesticated it. But I think, like you said, maybe the awareness is not high, so we need to bring this to the consciousness of our people that, that they can actually, enact this anti-discrimination law. And, the fines can be as high as $1 million, $2 million for corporate entities, and even jail terms, 1 year, 2 year jail terms, if found to be guilty. So we are now telling our people, those living with HIV/AIDS, those affected by HIV/AIDS, you can actually, sue people that discriminate or, stigmatize against you. But aside from that, we also have some communities, like we have network of people living with HIV/AIDS, we have non-governmental organizations, we have CSO, civil society that people can actually reach out to. We have NACA, we have a toll-free line, 6222, and then, of course, the 36 states of the Federation, they have what we call the State Agency for the Control of HIV, which people can actually go to lodge their complaints. But be that as it may, as a country, as good citizens, we should learn to embrace people living with HIV/AIDS, because like we said, it's not totally, we have this wrong assumption that everybody that has HIV/AIDS probably was promiscuous and got it from sexual. Like I just told you now, there are lots of children born with HIV. What do you do to this kind of children? Do you stigmatize against them? It's not any of their fault. Some people were transfused with blood and they got this, infection through that. Some people was from going to the barbers or going to the, using sharp instruments, pedicure and all that, and they got it. So do we even some health workers, I have colleagues that are doctors that are HIV positive from their exposure to treating people with HIV positive, and they have to leave. So we should embrace, because when we embrace them, then they will come out, they will get tested, they will access their medications, and when they do this, then their viral load, will be so low that they will not be able to transmit it to other people. And in that way, we are even keeping ourselves safe. Because when they are safe, then we are safe.
So we always talk about drug trafficking, prostitution, human trafficking and all of that, for prostitution purpose. What are you doing to reduce this scourge, into society? Because those who are prostituting, they actually, some are saying that you find it prevalent among them. Those who are sexually active, you find it prevalent among them. What are you doing to tackle, this menace?
Yes, we refer to those people as the key population. Sexual, commercial sex workers. Sometimes, I know people don't want to hear this, men having sex with men, people with, injecting drugs, and just like you said, unfortunate people, the child trafficking, child labor, and all that. So like I said, NACA has the mandate, of the government agency to interact with other government institutions. So we work very closely with other institutions, like NATIP and all that. And we ensure that, when they have such, unfortunate incident, they get tested and all that. For the commercial sex worker, actually, they have a very organized system. They have an association, and we are working very closely with them. In fact, many of them, we insist to their clients that you have to use condom. They will not have any unsafe sex. In fact, if you go there and you say you don't want to use condom, they can beat you up. That you want to come and spoil business for us here. So we are really interacting with them, we are educating them, we are providing condoms for them, we are providing testing for them, for a few of them that are positive, they're on treatment. So we have a very cordial relationship with that association, and even with people using drugs. We have what we call the harm reduction. They can actually, we have some centers that are not labeled, they're not known.
When you say drugs, you mean illicit drugs?
Illicit drugs, like people injecting themselves with marijuana, with cocaine and all that. We're not encouraging it, but when we do have them, we try to help them to go off it. So sometimes we have some centers that they can actually come to for counseling, for testing, and then, we supply them with injection, with needle and syringes that are new so that they don't have to reuse these needle and syringe while we're trying to wean them off. We're not encouraging it, but we're trying to make them stay safe while they're still that.
With some other
yes, we do. We do.
All right. I know you've spoken about this before, but talking about this anti-stigmatization laws, I believe this may be the bane for some companies, some private entities, pre-employment medical screening because of some sort of discrimination. They do not want to have an HIV patient or probably something of sort. What is the way forward? What do you suggest as regards these laws? Because whether we like it or not, discrimination is going on. If we can have companies that have to see your medical record before they employ you, then you should know that something is there.
Yeah, it's totally wrong for any employer to insist on seeing anybody's medical record. Yes, you can go for pre-employment testing, even for other diseases, not only HIV. And then, a medical doctor will give a medical report as needed to the right, authorities. But it's not, HIV, like we keep saying, is not any reason to deny anybody any job, because, yes, it's transmissible, but it's not as if it's transmitted through air or by contact or by, so why can't I be a broadcaster if I'm HIV positive? I'm not doing any harm to any fellow colleagues, So it's something we have to stop, so that people can actually, open up more.
Help us understand the concept of HIV itself, because, say, HIV does not actually graduate to AIDS. Or what exactly is the way it works? Does HIV actually kill people, or is it AIDS that kill people, or is it the combination of that? what is the process like, and what should we know?
Yeah, thank you. Like you rightly said, HIV, the human immunodeficiency, virus. It's a virus that attacks the blood cells, and then you can contact it through sex majorly, but through blood transfusion, through sharing of sharp instruments, and those are the major routes. Kissing, not likely, except both partners have sores and but those are the major common routes, and of course, vertical transmission from mother to children. People can contract this illness and this disease and actually not know for a long time, because sometimes it has what we call a latent period. Sometimes it could be for a few months, or sometimes it could be as long as a year or even 2 years, that there won't be any symptoms, there won't be, you won't even know you have the disease, and that is the latent period. But sometimes when people are not tested and they don't know their status and they're not on treatment, but they have the virus in their body, then they start deteriorating. And that is when it now leads to what we call AIDS, which is acquired.
So it's a person, that latent period, even if you're tested, you may not be
No, you pick it. You are not symptomatic. You don't have the symptoms, but it will be picked. And that is why we're emphasizing testing. Because if you're tested during the latent period, the virus will be picked. It will be detected in your blood. But just that you're not showing any symptoms. Just like people can have high blood pressure, and they are going about with BP that is so high, and they don't even know. But if you do the blood pressure, then you pick it up. So if you test during the HIV during that latent period, you pick it up. But people don't know, and that is why we're emphasizing testing, and testing. So you know your status, and when you know your status, you can access it. So if it's not detectable, or if it's not detected early, then it can lead to what we call acquired immunodeficiency syndrome, which is AIDS, and that is when the blood, the body system is so down, it's so very, the immunity is so low that people are so ill and they have so many infections, and it's quite life-threatening.
It actually opens one to different infections.
Yes, because your immunity is so low, you can't fight any infections. Your body will say, another one will come on top. So when you have such a low immunity, you have prone to almost, and it's almost like a multi-organ failure. And at that stage, it may be very difficult to save lives. And that is why we are saying that prevention is better than cure.
Okay. Absolutely. I understand that we also have different strains of the infection. Does this make a particular group with this infection more prone to infections more than the other?
Yeah, we have different strains, but I think those are the science. The most important thing, for the general public, so we don't confuse people, is to say, know your status. We have our test kits can pick all the strains. So whichever one it is, and whichever one has to be treated anyway, So know your status. Please go to the nearest government hospitals. They will do a confirmatory test. It's not as if you do the test and then they'll put you on drugs immediately. You do the testing in the community or wherever, they'll go ahead again and do some very technical confirmatory tests, because treatment is free, but it's very expensive even for government. So we don't just put people on drugs. And then we start the counseling. We counsel you for adherence, for compliance, for support. We even do empowerment, because we know you can't just be taking the drugs. You have to be well empowered. So sometimes for those that are positive, particularly the youth and the children and the mothers, sometimes we empower them on skills, job skills. You give them what to do, life skills.
Their mind is engaged in something rather than being depressed. And all that. So looking ahead, what are the key priorities and strategies that Nigeria should focus on to stay on track towards achieving the 2030 target of ending HIV and AIDS, and specifically what your office is doing in this regard?
Yes, I think the key strategy, like we said, because now the data is shouting at us, the data before us now is saying Nigeria has the global highest burden of pregnant women living with HIV/AIDS. We have the highest burden of pediatric HIV, children aged 0 to 14. In 2022, we had an estimate, a national estimate, and it put them like about 170,000 of children 0 to 14 years living with HIV/AIDS. About 26,000 of them were actually new infection of that year, and about 16,000 of them actually died from AIDS-related illnesses. So to me, that is our priority now. We want to reverse that trend. We want to stop, women transmitting the infection to their children. We don't want any child born with HIV/AIDS, and that is the strategy we're going to adopt. It's not only the health strategy, but also the non-health strategy that includes going to the community, talking to religious leaders, talking to traditional leaders, using what we call peer-to-peer, amongst the youth, among the women. We have some women that we use as mentor mothers, so that they know themselves, they can talk to themselves. We go to antenatal clinic and all that. We just want to find them, we want to test them, we want to put them on treatment, we want to reverse the trend.
Absolutely, reversing the trend and then making it, making Nigeria a better place for everyone to have a good health and experiences all over the nation. Thank you very kindly. First female Director General, National Agency for the Control of AIDS, NACA, Dr. Temitope Ilori. Thank you so much for
having me,
and for allaying so many people's fears regarding HIV and AIDS. Thank you.